But I'll go ahead and get us started. First and foremost, thank you, Hyann, for introducing us. That was awesome. I had this whole spiel, but I feel like you did a way better job of really talking about our roles in Seattle Public Schools and our histories. So I appreciate that so much. Again, my name is Stephanie Edler. I'm the program manager for mental health here at Seattle Public Schools, licensed mental health counselor with many years in community mental health, which is very dear to my heart. And so we just want to first and foremost say, acknowledge how excited we are to be here and to spend this morning with you guys. We also want to just extend our sheer gratitude for the work and things that you guys are doing in the community to support our students and families as well. Erin, I know that you've been introduced, but pass it over to you real quick for a quick little introduction again.
Yeah, good morning. I'm Erin Romanek. I'm very pleased to be here today. Thank you for allowing us this privilege and this opportunity to share some space with you this morning. As mentioned previously, I've worked with Seattle Public Schools for over 10 years. I'm just very grateful to kind of share our experiences and to help work in this collaborative effort to really support our young people as we're navigating through this pandemic and hopefully as we come out of this pandemic as well. So thank you for having us this morning.
And so today we're just going to be talking about wellness and mental health, raising awareness and just identifying some strategies that promote resiliency and increase protective factors. So really looking at kind of some national data, looking at how it's showing up in our schools and our buildings and what we can do to really support our youth as they're coming into our buildings day to day in terms of what they're experiencing around the pandemic, around mental health and social and emotional well-being, and how to connect them to supports. Next slide, Erin.
Give me one sec. I apologize. I am navigating here. Thank you. Thank you for your patience.
Quickly, we just want to acknowledge we don't have any conflict of interest, nor will we be discussing any off-label products or use. This class has no commercial support or sponsorship, nor is it co-sponsored. So to quickly just go through our agenda, of course, walking through our welcome in the moment through our agenda, and then Erin will take us over for our objectives. Once Erin goes through our objectives, we're going to ground ourselves in just really what it has been like for us in terms of our emotional well-being and ability to cope during the pandemic, and how can we take our experience and recognize the impact that it might have on our youth and be able to relate that experience. Of course, acknowledging the importance of wellness and why mental health matters. We know that mental health has been at the forefront of the pandemic. And one thing I think the silver lining with the pandemic has been able to really acknowledge that mental health does matter and is really important. I'll kind of go over some really large national data and trends, and then again, we'll bring it down to how is this showing up in our buildings through our Seattle Public School data, looking at some activities just to be able to shake it up a little bit, briefly go through some signs and symptoms of mental health concerns. And again, what does that look like as we're seeing our youth in our classrooms, we're seeing them transition through the hallways, on the playground, and as well as outside activities, grounding us in some universal strategies to promote resiliency and protective factors. So what do we do with what we know? How can we support our youth within our buildings, wrapping around them, providing a safe and welcoming environment, and looking at some key takeaways, and then giving some time for any questions that you guys might have for us as well. I'll pass it on over to you, Erin.
Great. So our objectives during our short time here this morning are in front of you, but I wanted to pause before jumping into the objectives and just share a little bit of information regarding Seattle Public Schools and our culture of care. Part of our academic and student well-being recovery plan that we submitted to our State Department of Education really was focused around mental health supports and services that we could provide to our young people. And so we are here with you today to be able to share this rich information that we have, again, in hopes of collaboration and really providing that wraparound care for our young people, because our school district has really focused on mental health supports and services for our students. And so I just wanted to share that piece because that was definitely a commitment that Dr. Jones, our superintendent, had made from the end of last school year into this school year and continuing on forward. So just wanted to share that really with you. So as Stephanie mentioned, we're going to discuss some youth mental health trends, some signs and symptoms of mental health concerns that we're seeing in our schools, and then really discuss some practices and strategies, some universal practices and strategies that can promote and strengthen wellness and mental health within our young people as well. What we're going to do, as Stephanie mentioned, we wanted just to spend a few brief moments kind of grounding ourselves with our own wellness and mental health. As professionals, I think the last presenter I heard say was looking for a vacation or looking for a break. So we know that all of us here have definitely also gone through professionally and personally a great deal over the last 2 years. And so we thought it was only proper and appropriate to take a little bit of time to really ground ourselves with our own experiences before we move into how we can support young people with what we know. So what will be in front of you and what I will attempt to do is we have a survey that will be in front of you, and there's a link that I have that I will put into the chat. And it's 2 very brief questions. And I want to just kind of read through them, and then I'll put the link in the chat as well, and then we'll look at our results. It's just reflecting on your own mental health and wellness needs, comparing March 2020 to January 2022. Are your needs about the same? Are they less? Are they more or significantly more? And then the second question is reflecting on the coping strategies that you have been able to access from March 2020 to January 2022. Are your coping strategies just as effective, less effective, more effective, or significantly more effective? This is an anonymous survey, so as results pop up, it'll be a pie chart and it'll be completely anonymous. So we do hope that you have the ability to feel comfortable to share kind of where you're at. And again, this just helps ground us and really getting a better understanding of maybe where our young people are as well. So if you will bear with me for 1 minute, I need to unshare the screen. So the link is in the chat, and hopefully you should be able to click on it and be able to submit your answers. And then what I want to do is share the screen so we can just see our experiences collectively as we are together.
I think folks are just putting in their responses.
Yep, and I'll just continue to load. Perfect. There we go. And we'll give about a minute or 2 to be able to answer. Do about another 30 seconds or so just to give an opportunity. Okay, so we have about 143 responses. I'm not sure how many are in our space today, but we definitely have had a great deal of response. And so just looking at our graphs here, we're looking at our blue is going to be about the same, our mental health and wellness needs. Orange is less needs potentially. Green is more, and then red is significantly more. Which I think we can all agree there's many, many factors that probably factor into why some of us are feeling like we have more mental health and wellness needs 2 years into the pandemic. And looking at the bottom as well, our blue is our coping strategies are just as effective, orange, less effective, green, more effective, and then red, significantly more effective, which is fantastic to see. I need that secret. I need that coping strategy. And we do just want to thank you just to kind of share Again, thinking of our young people, we as adults potentially have some pretty well-developed coping skills. We're in the field caring for others, and that profession often requires us to have those skills anyways. However, the pandemic has definitely had a significant impact on those, obviously, within the caring professions as well. And so thinking our young people who have not fully developed all of the kind of a suite of coping strategies. We just want to keep this in mind as we kind of go throughout today of how much we have been impacted as adults, and to think then how our youth impacted as well, and as we put this all together. So thank you very much just for taking that time to fill out our survey for us and just kind of share. So when we think about our wellness and mental health, nothing here is new to many of us, but we know that it impacts all of us. We know that our mental health and wellness affects all areas of our life. We know that our wellness and mental health is important in all stages of our life, depending on where we're at with our careers and with our families and just in life as well. We also know that our wellness and mental health aids in resiliency and recovery from different life events that kind of happen to come up for us. And in addition, we also know, Stephanie mentioned, with the pandemic, being able to, especially as a school district, name mental health and wellness and really talk about it and kind of bring it out from some of that stigma and shame has been incredible. In my 20 years of education, I've never talked about mental health as much. I have always as a social worker, but it's never been welcomed in so many different spaces as it has been this year. And so really hoping that this leads to accessing more care and just normalizing that we all have mental health and wellness and that it does matter. And there are different points in our life where maybe we need to tend to it more than other points in our life as well. And so I just want to think for a minute, think about your morning, think about maybe your evening yesterday, think about if you've read the newspaper, if you've watched TV, if you've listened to the radio, if you're on social media. Did you notice, was there any discussion of mental health and wellness, let's say within the past couple of days, that you have listened to or heard about on the news? And if you could, we can use I know Slido as far as for questions, but if there's just anything you could put in there to say, yes, you have experienced this, no, you haven't. I'm just curious if you yourself have had the experience of just hearing about it more, just in kind of normal everyday conversations with either other people you know, or just kind of within community or within radio, television, anything like that. I see a thumbs up. Okay, I didn't realize WebEx allowed me to do that. Great, I see thumbs up. Thank you, that's great. Okay, so we have had that. A couple other pieces I know, we've had a number of just like celebrities and people who are influential in kind of that way, especially younger people, musicians and actors and actresses that are really speaking up about mental health and wellness and why it matters and ending that stigma and shame. So again, if there is a silver lining that we can look at is that we are being able to talk about this more, which again, just hopes that it helps us get towards access, care, and normalizing that this is just something that we do. It's another way we take care of ourselves, just like our physical health. And so I just appreciate people who have louder voices than ours, who are in community and who are in social media spaces that are really bringing that to the forefront as well. Because I think in the long run, that will help support all of our young people for them kind of as they move throughout their lives from the pandemic as well. So just thank you for that. Thank you for the interaction as well. Appreciate that. And now I will. One other piece that we just want to also let you know within Seattle Public Schools, and again, probably not unfamiliar to many of you on this call, is that we really truly believe that all behavior is a form of communication. And so anything that we're seeing for young people, it's really trying to look at that with curiosity and understanding about what that young person is trying to tell us, what they're trying to share with us, what conditions maybe aren't right for them within our school settings potentially, or maybe how do we need to connect with them differently or in a way that helps really support them. And so looking at behavior is really not something that we want to punish or we want to exclude, but how do we learn from what it is that they're trying to tell us if they're not able to tell us actually in words or to verbalize how they're feeling. And so that is kind of foundational to our work in behavioral health and mental health, and even our discipline work that we do at the district is really having this foundational piece of behavior is a form of communication. And as adults, we have to have that curiosity to understand what's missing for them potentially and how we can fill in that need for them as well. Stephanie?
Okay, so I'm just gonna kind of briefly speak about just the overall data that we're seeing around youth mental health. There's tons of data and information coming in as we go. As we know, experiences pre, post, and still in the pandemic, there is a lot of repercussions and impacts that it's having, re-entering back into school, having to go remote, coming back. And so we're just seeing a lot of different emotional needs coming from our youth. So I'm just going to kind of go through some brief data. So what we noticed is that 1 in 6 youth ages around 6 to 17 experience a mental health disorder. And again, when we're acknowledging a mental health disorder, we're really thinking about a diagnosed disorder that their emotional well-being is impacting functioning in multiple areas. So how this might show up in the classroom, say roughly if we have about 30 kids in a classroom, we might anticipate that about 5 kids in that classroom either have a diagnosed disorder or a diagnosable disorder. 50% of all lifetime mental illness begins at age 14 and 75% by age of 24. And the reason why this is really important for us to look at is the fact that we have a really large opportunity to do some early interventions in that middle school, elementary age that might help decrease the manifestation of potentially a mental illness or mental health diagnosis, and being able to triage and connect that youth to and family to support to be able to provide an ability to recognize their own emotional well-being, provide coping skills, and get them some support. 70% of our youth in the juvenile justice system have a diagnosed mental health disorder. What's really important about this is recognize that oftentimes we are punishing our youth for their mental health needs and illnesses and disorders, rather so than, again, looking at some early interventions or wraparound supports to be able to support them. Suicide is the second leading cause of death amongst youth aged 10 to 34. I think we all here on the call can really recognize the influx of suicide ideation and intent, the impact it has had on our healthcare system, and the struggle of being able to get youth and families into support that meets their need right away. Also, just recognizing, according to the Agency for Healthcare Research and Quality, that there is a large racial disparity of rates in diagnosis, treatment access, and prognosis. Communities of color are less likely to have mental health services that are evidence-based and receive care that are more so lower quality than their white peers. As well as in schools, Black and brown students are less likely than white students to say that they have reached out to a counselor for their mental health need and gaining support. We've seen significant disparities and disproportionalities within the pandemic that has impacted, again, our students and families of color, and continued impacts in regards to access to care. And again, I just want to acknowledge that we know that these numbers have been increasing over years: mental health, substance use, suicidality. The trends have been trajectorying up prior to the pandemic. However, we know that the pandemic has significantly exacerbated these statistics in many different areas. I think we're on next slide, Erin. Thank you. So continuing to look at some of the rates, I'm really just kind of focusing on depression. I think we would see similar statistics around anxiety. Mental Health America is a community-based nonprofit organization that really looks at mental illness and mental health disorders, and does a lot of survey and gathering information per state as well as nationally. And so what are some things that stuck out that I wanted to highlight is a growing percentage of youth in the US live with major depression. And we, of course, when we think about major depression, clinical depression, that's severe and persistent low mood, sadness, irritability, that impacts functioning. What we found is about 15.08% of youth experienced a major depressive episode in 2021. When we think of episode, depressive symptoms, again, that are impacting functioning, that are within a specific time frame. This was about a 1.2% increase since 2021. Over 2.5 million youth in the US have severe depression, again, impacting functioning, and multiracial youth are at greater risk. About 10.6% of youth in the US have diagnosable severe depression, and that has been highest among youth who identify as more than one race. And so about 1 in every 7 multiracial youth have identified with severe depression. Over 60% of our youth with major depression did not receive any mental health treatment. So that's about 1 in 3 youth go without treatment. Aaron, if you could pop to the next slide for me. And mean that nationally, fewer than 1 in 3 youth with severe depression receive consistent mental health care. Consistent meaning, scheduled weekly appointments, bi-weekly, depending on the need, or bouncing in and out of treatment. Youth who receive care, only 27% of those youth receive consistency. Both adults and youth in the U.S. continue to lack adequate insurance. 11.1% of Americans with mental health illness are uninsured, 0.3% of increase from last year, which we could probably acknowledge that a lot of job losses through the pandemic have definitely increased our youth access to care, as well as just the sheer volume of need that we have and the lack of providers that are available. Rates of substance use are increasing with youth and adults even prior to the COVID. So again, back to mental health, suicidality, as well as substance use have been increasing prior to the pandemic. However, what was found was that 4.08% of youth have a substance use disorder. Again, recognizing a disorder is a diagnosis that impacts multiple areas of functioning within the past year, which was a 0.25% increase from the previous year. So, again, it's fair to say that the pandemic has definitely increased a lot of these trends significantly. I think I don't want to minimize the impact, the anxiety that this pandemic has also had on our youth and facing the unknown and uncertainty, as well as recognizing that the community is really struggling to meet the needs and demand of our youth when it comes to access to care. So I'll go ahead and pass it over to Erin, and she'll take some of this information and recognizing where some of this data looks like within our buildings and the trends we're noticing within our youth that show up in our data here at Seattle Public Schools.
Thank you, Stephanie. So the data I'm going to share with you is collected from various different access points within our district. And the data also might not accurately reflect all students' experiences. So I just want to keep that in mind. Some groups of students may be overrepresented since a lot of the requests and supports that come in from our schools are voluntary or self-reported or self-initiated as well. So just wanted to put that out there. The first thing you'll notice here is we run, Stephanie and I support a discipline support call phone line that's staffed every day from 8 to 5. And from this time point, from the beginning of the school year until December, we had taken in 195 recorded calls that come in mostly from school leaders. You can see there's a range from mental health, violence, incidences of violence, and then also substance abuse as well. And that is a 52% increase. So if you go back to the same time frame from the 2019-20 school year, which was the last time we had students fully in school, we have had a 52% increase in calls over that same time period. So again, this is just another data point that supports what Stephanie had kind of already shared regarding the mental health needs that we're seeing within young people across the nation as well. We also use a different data point. This is our discipline data. And again, remembering that we really believe all behavior is a form of communication, but in front of you is just a time frame of incidences that represent when a student was excluded from school. And underneath all of these incidences are many other attempts at other school-based responses or other wraparound support interventions that schools have tried before getting to this point. So just kind of looking between elementary, middle school, and high school. And we have roughly 52,000 students. This actually number is less than the number it was between the 1920 school year. So discipline incidences have decreased since then. But again, just thinking about our adults in the system who are providing care and this wraparound support for young people is largely impacting why our suspension and expulsion rates haven't been as high as they have been in the past. The next piece of data that we have as well is Stephanie and I also support our critical incident crisis response in schools. And so in front of you, you have a breakdown of the different types of situations that we've been called in to support this year. So it could be a loss of life that has happened. It could be responding to an incident of hate and bias. It could also be responding to threats, so school shooting threats. The month of December with the infamous TikTok challenge, if any of you have young people or have worked with young people, regarding that really caused us to have a spike in responses to threats of harm to our school communities. We've also responded to acts of violence in a school and then acts with sexual assault as well. And so in front of you just kind of shows that data. Again, going back to last school year, even in remote, we've had a 100% increase in the amount of critical incident crisis response that we provided even when we were in remote last year. On a typical year, we typically had responded pre-pandemic to about 20 different unique incidences. Last year, we had already had 14 during this time period, and this year we've already had 28. And so again, just showing from the 1920 school year to now, it is a 250% increase that we have been responding to for critical incident. This year alone, this is just a snapshot. We've had 32 unique schools or departments impacted. We've had 7 schools or departments impacted multiple times. Again, this is from September to December. We provide a wide range of support into schools as on-site support, communications, family support, creation of affinity groups as well, threat assessment support. So again, these 3 pieces are just data points for us as we kind of look at what's happening nationally. Also in the month of December, there was a school shooting that occurred in Oxford, Michigan that definitely was at the same time as the TikTok challenge. So we saw lots of just increase in worry and anxiety for young people, and then our need to respond to different threats that were occurring. So lots of different points for us to look at that really indicate that Seattle is definitely experiencing what our country is experiencing as well in terms of just different impacts to mental health that we see within our young people.
Okay, so we're gonna do a quick Padlet activity. Erin, I'm just watching time too, so
Yes.
We know that we gave you a ton of information, again, looking at some of the national data and trends, and again, how it's funneling and siphoning within our buildings and what we're noticing just within the data of our crisis response and our support. So our question for you is, and just curiosity, with all that information that we have given you as a, as a practitioner, as in the community, in buildings, who are definitely supporting young people and families, what is the national and SPS data telling you? And so, Erin, are we going to stick with the Padlet or should we do chat?
I think chat might be the best for this.
Yeah. If you want to throw some of your ideas in the chat and just kind of give us some insight of what is coming up into mind for you when you're hearing about these trends and what we're seeing in our buildings. It would be really lovely to hear kind of your voice and writing in terms of what kind of initial thoughts are coming up for you. And I'll give maybe like, I don't know, a minute to kind of put it in the chat.
It looks like some of the chats are going as a private message. Maybe I can read them out.
Oh, okay. Yeah, I was just going to ask you. Thank you. I was like, wait a second.
One of them did. Yeah, someone said it shows the significant concerns of our children and the need for support. And I think the rest are, there's one with the shortage of available therapists and feeling that the support is what's available at school and home only. And I can recognize the increasing mental health needs of my students, but what should I do in addition to referring students to counselors or school psychologists? And it just seems to reflect the extremely challenging times we're in. Youths don't have as many coping mechanisms, so it makes sense that we will see more crisis response.
Thank you. And I think what we also want to recognize is we have staff who are unwell too, right? So the pandemic has also impacted our educators, our supports, our school leaders, and so that can also play into some of the things that we're seeing because people are really struggling to be able to stay well and cope during this time. Erin, we'll move to the next one. I guess we can do that just real quickly. Our curiosity is for us, as practitioners who are supporting, again, young people and families, what have you observed in your own workplace when families are coming into you or asking for support? Are you guys noticing similar trends as we're noticing in our buildings? Diane, I might need to get support from you again for reading some of those comments in the chat. If you want to place some of that in the chat, that would be wonderful.
Yeah, I can read one that just popped up. The data shows that we need more supports in our schools. And in the middle school, we have a mental health therapist, behavioral health therapist, student achievement specialist, counselors, and the school nurse. And schools have seen all of these things. The struggle has been in finding support for the kids who need it. Many therapists and counselors don't accept insurance, so it further discriminates against families who can't afford the out-of-pocket costs. And there's a sharp increase in mental health and medications, psychosomatic illnesses, students missing class for anxiety, and an increase in self-harm among secondary school students.
Yeah, and that is definitely everything that we're seeing too. Our school-based health centers, our school-based social workers, our community-based supports are busting at the seams and trying their best to triage out to supports. We know our private practitioners are also full. So it is definitely, I think, in itself a crisis, right, in terms of getting our youth and families access to care. Erin, do you want to go ahead and pop to the next slide for me? Thanks. So I feel like I'm almost kind of preaching to the choir a little bit here when I'm going through some of these. So I just want to acknowledge that. I know that, our community that we're, together here, it definitely recognizes where, the signs and symptoms of mental health concerns. But I do want to kind of just briefly go through some of the things, again, that we're seeing in regards to the impacts that it has of our youth that are coming to our buildings. I also just want to acknowledge that oftentimes we have youth that are spending 6 to 8 hours a day in our buildings. They're spending majority more waking hours within our community than they do oftentimes in waking hours at home. And so, that is a big responsibility and ownership that we have as a community to really wrap around our youth and support. So some of the things that, again, to highlight that we're seeing is the social withdrawal, recognizing that there's less interactions happening in class, youth being more quiet, not raising hand or interacting with peers, decrease in interest, withdrawing from previous activities that they once enjoyed, sports or school activities, or their academics themselves. I have a lot of youth who really thrived at one point, and there was a lot of value around having strong academics, and the motivation to be able to continue that has been really challenging and difficult. Easily angered, upset, and frustrated. So we see a lot of physicality happening, pushing, being physical, short-tempered, using bad words, oppositional behavior, as well as difficulty just following direction. You would kind of see that in the trends that Erin spoke about when we look at our incidence reports around fighting and physical aggression and violence. Difficulty with concentration. So just, the stamina of not being able to do, the work, following along in class, not paying attention and putting head down. Our kids were in remote, and that setting could have looked very different for depending on the youth. And so I think all of us can be able to have us come back, and spend 6 hours of education. The stamina is just not there. We know that our kids are significantly been impacted by the lack of education, and some of our youth are floundering in what has been missed, and trying to catch up, as well as our educators trying to support them. Attendance concerns, school refusal, skipping, class avoidance, which whether it's hiding in the bathroom, avoiding class altogether. There's a lot of fear and anxiety around catching COVID and social distancing, the worry of getting sick, and the impacts of getting someone in your household sick as well. As was said in the chat, the somatic complaints, tons of youth not feeling well, headaches, stomach aches, unexplained aches and pains, often asking to go see their school nurse multiple times a day, multiple times a week, as well as their school counselor and social worker. Suicide ideation, we have a lot of ideation and intent in our buildings, and our school-based supports are really trying to, again, triage around and support our youth with their suicidality, looking at that negative self-talk, the view of the world, self-harm or risk behaviors, giving items away, point blank saying like, I don't want to be here anymore. The world would be better off without me. The pervasive sadness, tearful crying, head down, lack of joy, withdrawal, isolation, and weepy. The youth are really struggling to engage in being able to cope with the day-to-day things that they're facing and their emotional well-being. Behaviors that pose risk to others, again, being physically aggressive, indirect or direct threats towards others, possession of a weapon. Aaron spoke about, the impacts of the TikTok challenge, and Michigan acknowledging that we have, youth posting on social media, like threats of violence towards a peer, threats of violence towards a school, and the impact and the ripple effect that has on a community is great, and the fear that it creates for families and students to even want to walk into the buildings. And lastly, anxiety is just kind of skyrocketing. The inability to control worry or fear, the inconsistency with messaging and changes within COVID and protocols is really, really, really daunting and hard for kids to understand. With the ruminating, the social anxiety, we were isolated for so long, and learning how some of those social skills with a mask on, social skills and learning how to social distance is something that is so outside of the norm, and trying to support youth in building up those skills, as well as just increased avoidance. And we see a lot of eloping behavior, a lot of lack of sleep, a lot of struggles as well. So with looking at, again, some of this national data and recognizing that, how the impacts are showing up in our buildings, Aaron's going to speak a little bit about how some of the universal strategies and how we can promote resiliency and build some of those protective factors for our families while we have our youth within our care.
Thanks, Stephanie. I do want to provide some hope here, because the data and just the overwhelming volume of what we're asked and expected to respond to when young people are with us, right? We're in spaces with them, and of course we're going to support. But just definitely want to share that there's some hope that we know, while yes, some students we will need to connect to community agencies and different therapists and outside, providers, and we know that there's limited in those right now. But there are some things that we can do universally, which every one of us can be able to be a touch point for a young person and be able to do many of these things that can help really promote resiliency, which then in turn help strengthen, as Stephanie talked about, those protective factors as well. And so again, critical that students are connected to at least one adult in the school, that students are recognized and greeted daily by their names and pronouns, again, giving that identity safety for them, that wellness and mental health are acknowledged within our school communities. Again, these are things that we have some control over as far as working in buildings and being able to support, or being able, again, just to be in spaces with young people, having existing relationships with community partners, and really making sure that those partners represent cultural and racial backgrounds of the students and families that we serve as well. When we think about consistency and predictability for young people, we also think about what are our expectations within our schools and within our classrooms, but to make sure that those are co-created, that we have conversations with students and families and community about what consistency and predictability should look like within our classrooms and our schools. Being able to provide culturally responsive student feedback and acknowledgement as well. Really embedding, so when we talk about like our social emotional skills, that they're modeled, taught, and practiced for students in classrooms. So it really is, we talk a lot about these universal or tier one. It's not necessarily I'm going to go down the hall into a room and the counselor, the social worker is going, to teach me these skills, but it's that we all are modeling them and teaching them within our classrooms, and they're being woven into instruction as well. Even at the high school level, we've seen really amazing examples of how this is done within a biology class, or how this is done within a trigonometry class as well. Also making sure that as schools we're engaging and communicating with families, especially in the language that is familiar to family as well. We have really found this year too is just, we really need to be responding to incidences of hate and bias very swiftly, and acknowledging the impact that it has, especially if it's hate and bias, like racial hate and bias, like towards our communities of color, our Black and Brown youth. And that in itself will help prevent and create some safety within that school, knowing that that student for who they are is welcomed, and that acts of hate and bias will be denounced that is not acceptable within our communities. And that's something we've gone through this year specifically. And also that we're doing community and celebration circles in our classrooms, and we're taking the time to connect really in relationship. And so I know we both represent kind of an academic institution, but we really feel strongly like that we don't really meet the needs of the social emotional needs of young people. We won't get to that academic instruction. So really being there and being present, and that's something each one of us can do in the lives of our young people. It doesn't, anyone in our buildings, it doesn't take a mental health therapist or someone with clinical skills. We can be there and be open and check in with kids and just say, hey, how's it going? Are you doing okay? And then knowing if we can refer or get them connected if there's some more support needed. So we wanted just to provide a little bit of hope, and Stephanie's going to speak about some protective factors as well, because we do have some control in this pandemic to really make a difference in the lives of young people.
And I just want to acknowledge some of the conversation that's happening in the chat. Absolutely 100% agree with some of the barriers and things that you're noticing within your own children, within, their education, and the anxiety that is within that too. So I'm trying to figure out how to look at the chat and do everything at once. So I apologize, but I just don't want to neglect the fact that I'm trying my best to read them. And my hope is when we have some of that time, we can have some of that conversation. So thank you so much for plugging those thoughts and experiences in. So moving forward to looking at, some of our protective factors. One way we can support students' mental health is really providing protective factors for them. What do we have control within our buildings? Again, back to that 6-8 hour, time that we have to be able to support our youth, those waking hours. Some protective factors that support student mental health include sense of safety, school connectedness, cultural pride, caregiver engagement, community collaboration. I think, again, we could probably add more to the list as well. However, when we are looking within our buildings, we're really focusing on some of these key aspects. So when we think about a sense of safety, which really is the extent to which a child is free from fear and feels secure from physical and psychological harm within their social and physical environment. Again, as they walk into our buildings, they can feel safe. They feel like they are seen for who they are as individual and connected to a supportive adult. This can also be provided by creating a safe and welcoming environment. Again, back to that supportive adult, knowing the student's name, their pronouns, getting to know them, asking how their day is, connecting with them. School connectedness, the belief that is held by students, adults, and peers in their school actually care about them, not only about their learning, but about them as individuals as well. Cultural pride, being proud of one's culture, traditions, political systems, religions, as demonstrated by really spreading cultural awareness to the community through leadership, determination, dedication, and passion. Back to, again, you'll hear probably this a lot, is, creating a safe and welcoming environment for students and staff. A lot of our buildings, majority of our buildings, not if all, have a family engagement team that really look at how to engage families and have cultural nights. Obviously, a lot of things are done through Teams now, but highlighting a specific culture within their building and inviting all the families to come to learn about that culture, have performances, and provide education, and then giving an opportunity for different cultures within their community to connect together. Caregiver engagement, it's not uncommon, and we'll really speak to this, the importance of the engagement that school has with their caregivers, giving the caregiver the opportunity to speak on their child, to advocate for their child, to take in the information that they know their child best. Caregivers and school staff are really just looking to work together to support and improve not only learning, development, and their well-being, as well, again, of their health of their children and adolescents. And then lastly, but not least, is looking at the community collaboration, looking at the integrated care, that wraparound support, that we're really connecting and collaborating with not only families, but outside entities, supportive adults in the building, any other natural systems and supports, whether it's a clergy, whether it is a coach, and again, bringing in those perspectives to really give an opportunity for the team to sit around, medical professionals, to sit around the table and collaborate in terms of how do we look at this as an entire system, an entire wraparound support to be able to support this child in their learning. So with all of that being said, I feel like threw a lot at you, so I feel bad for that. You know, in closing, really looking at, you know, my curiosity, I think for you all is really looking at, like, again, starting large, looking at the national data, siphoning down and how it's showing up, not only in our buildings, but showing up for you guys as well. And seeing how this is, my curiosity is looking at how is this, seeing how this is, sorry, I'm like, wow, I've been talking too much. Sorry about that. Looking at how this, again, like, what are we recognizing based off what we're, you know, what we're seeing? And I think we're also learning as we go too. Again, we haven't naturally been faced with something, you know, compounding things happening within a community at once. And so, one thing I would be curious about is what is one takeaway from the presentation that can inform maybe your practices? Things that maybe you didn't know within the school setting, or things that you recognize that you might not have been as clear about in terms of some of the things that we presented today. If we want to pop it in the chat, that would be awesome. Or if we want to, Erin, I don't know your thoughts, we could stop sharing and we can just, you know, also speak out to it, if that would be helpful.
Yeah, and I can read the comments that are coming in from the chat, but I just did have some initial thoughts. I think, you know, I think we're all aware of the prevalence of, you know, mental health and kids and how this pandemic has affected them. But I think the actual data that you've presented really puts things into perspective. You know, I can imagine a class of 30 kids and 5 of those kids have something going on. So I think that's really significant. And so much of learning is tied to your emotions, and, you know, that could determine how well you do at learning. And so I feel like mental health has always been looked at from a treatment perspective. So, and I'm kind of seeing that, you know, there's a shift in, right, so what can we do to support these kids before that stage? So how can we shift completely into a preventative care to, you know, increase more awareness and training in the support that they're getting in schools, and provide them the tools ahead of time, so that in the event that they do encounter a mental health challenge, that they have the capability.
I do just want to read and acknowledge one thing in the chat about just staff being maxed out. Absolutely. If we aren't, I mean, we often talk about, if I'm not well, how can I care for others? And I think we had someone acknowledge the other day that staff is oftentimes no longer being curious about behaviors, because again, their resources and availability to be curious are wearing thin, because again of the significance of behaviors we're seeing, their own emotional well-being and being tapped out and taxed out, and trying to show up day to day and teach classes in a way that's never been taught before. And so I just want to acknowledge that our students are struggling as well as our staff. And I think our staff can be acknowledged as well, because it is hard, and we see a lot of burnout happening, which again can impact choices and ability to teach. Just as you said, Hyan, as students' ability to learn, if we don't manage the mental health and support them, whether it's just acknowledging we all have mental health, we all have wellness, we all have emotions, and that's okay. If we don't acknowledge and support that, their ability to access education is so hard. It's so difficult. And so we've tried our best to really look at how do we help teach some of those practices, so again, they can show up and have more access and ability to learn.
And a comment in the chat, I wish that my school administrator would see me, the school nurse, as part of the team to deal with mental health issues.
Yeah, I just want to validate that. I think especially now, we need as many people as possible to be providing that collaborative, like comprehensive support. And we can't do it alone, for sure, right? And even with school leaders, sometimes when we have conversations with them, like that's what we're prompting and asking is, who's in your building that can help you problem solve and wrap around this young person? And so nurses often comes up, the school psychologist, school social worker, counselor. but it could also be those connected adults to that youth, right? Who cares for them. It could be the custodian, it could be nutrition services, it could be front office staff, right? Who is on that care team for that young person? Because that is, again, the one thing we've learned is this is way too hard for any of us to take on and handle alone. And there's, with more minds at the table, we're hopefully, right, we get to better outcomes and better support in putting those pieces together to really comprehensively support that young person. So I'm sorry that that is your experience, but I agree with you 100% that helping support mental health should absolutely be something that a nurse is invited into doing.
Another comment, as a parent, I am reminded to look for ways to provide consistency and predictability at home, in addition to recognizing ways to further foster a sense of belonging and pride.
Yeah, it's interesting, just one piece, when we provide kind of our critical incident and crisis response, we go back to the first pieces are that consistency and predictability, because that gives that sense of safety that Stephanie was talking about. And so again, from school into home, it's equally important as well. So thank you for bringing that up.
And I know that, you know, we tried to do that and we tried to reinforce that consistency. What if the child does not have access to that consistency, or their, you know, situation doesn't allow for that?
As far as at home, you mean? If it's more of a struggle?
Mm-hmm.
Yeah, I think what I would think of working with a student, maybe that it was, you know, not as consistent at home as at school, is what is that for them? And then also trying to work with the student. And it's harder if we have our younger, you know, students, but what can they do? What's consistent for them? What are some practices that they can do? What does a schedule look like for them? And so even trying to put some of those things in, even if maybe it's a different home environment, maybe that they're going to each day, or they're, you know, switching between different places, or it's a different caregiver, but what can they do to kind of create that schedule for themselves, to be able to kind of put into some of those places of what's consistent and predictable, so we know what's coming. With our younger learners, we use visual schedules a lot, and to be able to kind of create that for what do they have control over at home, because so many other things are outside of their control.
Mm-hmm. I think there's a lot of acknowledgement in the ability of the adult to provide that support. So what can we do to teach those adults coping skills, so that, or to teach it at home, so that the mental health isn't only being focused on at school?
Yeah, I know something Stephanie and I had talked about in being able to even provide, and because we as school, right, have become hubs of all things, right? A lot of things for young people, including parents, and access and potentially ways to get mental health support. But even with schools, again, what is that universal support we can provide about just education around mental health, and what are community resources, and being able to provide that to families as well, not necessarily the direct mental health support that we would be providing as, you know, as providers in schools, but at least still hosting and just say, hey, these are different community services that are available, right? And then potentially we have had some staff that have made referrals for families and have tried to make those connections, because there's so many barriers within systems to be able to access that, sometimes being able to help parents through that, because we know eventually that will support our students, right? But again, we have so much limited time. That's why it's difficult where we kind of spend our time, right?
Yeah, I think just another comment with how things are constantly changing with constant disruptions. How can the kids feel safe when the sands are always shifting? And so what are your recommendations with what can we do now in the school setting to reassure kids, because they don't know what policy is going to come out next? You know, I feel like when they go to school, if they were in school 2 years ago, they could feel like this might be my last day of school.
Stephanie, do you have thoughts?
I mean, yeah, I mean, and it's hard. I think even us as adults, we're like, hey, what's the next day gonna bring? You know, especially with Omicron, right? We saw like things having to shift. And I think, you know, part of that is, and I think we've done a better job at it, is pushing out that communication to help prepare and control what we can, you know, and some of it is trying to face with the things that we don't have control over, and how do we manage that anxiety of the unknown. And I think a lot of that is, you know, having those conversations within our classrooms, right? When kids are asking questions like, hey, Miss So-and-so, are we going to be going remote tomorrow? What does that look like? Those are a lot of questions that kids want to know. And also, how do you have those conversations at home and staying, and again, with what information is being put out there and having those conversations with children with what is appropriate to say, how do we prepare for things if they do shift? What can we do? What are things we can control and how do we figure out the ones that we can't? I have a lot of youth who are so anxious around the fear of, I'm going to go remote for a week. It's going to turn into a month. It's going to turn into a year and a half. I don't want to go back here. And we also have staff who are saying that, who have had to quarantine, for a week and say, man, that was too familiar. That doesn't feel good again. So I think, acknowledging that it's hard, acknowledging, getting their perspective. How does this feel for you? Getting their ideas and what's coming up and then how to support them. Or even, again, talking to, their supports at school, hey, if Miss Stephanie was their support in school, how do you give that information to their supports to help check in with their child at school and building maybe some of those support plans for them to help cope with uncertainty. Because we're all facing it. Every day is a different day, every minute something we have to shift. And all of us have this hope and this desire of wanting things to go back to normal. And that is so heartfelt, that's so understandable.
Yeah, and I think we all can recognize that kids don't do as well with transitions. I mean, some adults don't either, so I can can recognize the struggle there. And I get with the data that you've shared, this is our last question. Can we differentiate between the mental health impacts of COVID, the disease, and the mental health impacts of the mitigation strategies? Like, what part has played a significant factor in the rise in mental health crises in youth?
Yeah, I don't know if we have a good way to differentiate. I mean, thinking about just the anxiety alone of like the medical impact of, contracting COVID or having COVID, having symptoms versus all of the other worry and anxiety about just grief and loss that students have been through as a result of it, or that I have to wear a mask, or I can't hug people, right? When we first came back, I couldn't hug our team, and the impact of that. So I don't know if we have all of that teased out. Just, I guess we're looking at it in terms of when we were in remote and when we came back in person, we saw a very different set of young people in front of us with intensity and frequency and duration of behaviors. So it could be that it's a combination. Maybe in time we'll be able to kind of tease it out a little bit more, but definitely just recognizing there is a big shift in difference in students pre-pandemic to now.
All right. Well, thank you so much for all the work that you do in the schools to support the youth. And this talk just really highlights what's needed, the foundation to just shore it up and help the kids succeed and catch up. Thank you so much.
Thank you. Take care.
And
thank you for allowing us to be here.
Yeah, thank you. Now we are going to go on break and come back at 10:50.